When collecting a sample from an indwelling catheter, strict infection control procedures must be followed to ensure that you're not going to introduce the infection into the line. The method is: clamp the catheter above the connection for no longer than 10 minutes. Wash your hands and don your gloves. Disconnect the catheter from the bag, remove your lid from your urine jar and gently remove the clamp. Allow the urine to drip into the urine jar, place the lid back on and label the urine jar with CSU or catheter specimen urine. It is important to remember, never allow the urine bag to be higher than the patient's bladder. The urine can drain back into the bladder, which will cause your patient to be in pain. I'm going to demonstrate how to collect a sample from an indwelling catheter. Firstly, explain to the patient what you are going to be doing. The doctor has ordered a sample from your catheter. I'm just going to need to clamp the catheter for 10 minutes, and then after 10 minutes I'll get you to come back into the room. Is that okay? Yes. This is the G-clamp that we use to clamp the patient's catheter. We just go above the joint and tighten it. Just set the timer for 10 minutes. Never ever collect the urine straight from the bag or the spigot. This bag could have been on the patient for 2 to 3 days or 2 to 3 weeks, we don't know, and it may contain a lot of bacterial overgrowth. Now that the 10 minutes has elapsed, we need to place a bluey on the patient's lap. This is in case we spill any urine. We do not want it to dirty their clothes. We'll just place a bluey on their lap. You need to turn the lid of your urine jar and just sit that down. Disconnect the bag from the catheter, and you do this by pulling these two ends apart. It is really important not to touch either end because you could introduce an infection to the patient. I then get my patient to hold this end. Be careful not to touch the top for me, just hold that. Urine jar. Being careful not to touch the inside of the jar, and slowly release your clamp. The urine should start to flow. Once you have enough sample, place the lid on your jar and you must reconnect the bag to the patient's catheter. Then you can completely undo your clamp. Label your jar with the patient's surname, first name, date of birth, time and date of collection, and CSU, catheter specimen urine. Never attempt to take urine from this port. You won't get any urine from this port. This is where the person who puts the catheter in injects some water, and it actually inflates this little balloon which holds a catheter in the patient's bladder.